Okay, so let's get started. So like overall, let's just start out how we usually start out debrief. How do we feel everything went?
I thought it was fun.
I thought we all worked really well together.
Yeah.
So we thought we worked well together. River Falls, how did you think things went when you were caring for Patrick on your end?
Good.
I think teamwork went well.
Yeah. It was interesting to see how we really worked together in an intense situation, kind of.
Yeah, and we wouldn't get that whole experience of transferring a patient from one facility to another working in the HPS lab without this type of a scenario. So
I actually think you guys did a good job eventually of figuring out, hey, wait a minute, we got to stop and listen and talk to each other and figure out how this is going. I thought that went really well once you figured that part of it out. How do you feel like the instructions went? How did that all go back and forth? Do you feel like the instructions were clear, that you got to the end point that you wanted to get to?
Yeah, once we started talking one at a time, it was, you guys were great with your directions.
And then the equipment.
Yeah.
And this is a great point. If you were really an actual critical access hospital, one of the first things the therapist needs to know is what equipment do you have? And then you probably should get on your iPhone, iPad, computer, and be talking to them while you're trying to figure out what equipment they have. The communication between that, I thought you guys, given what was there, I thought it was really well done.
Can we go back to a second for RT? I think it's helpful for nursing students to know what exactly do you want to know when you call for an RT consult?
We want to know what disease process is happening, first and foremost, and then vital signs. Breath sounds are huge. Age, weight, height.
We want to know the exact same things almost that you're giving any other nurse or any other provider that's calling.
I really liked with the Eau Claire students when, after we had given reports to them, it was nice. I liked how they were able to sit her on the bedside. Obviously, the patient was technically not there yet, but they were talking and planning out how things were to go and what they wanted to do. So I thought that was a really good way to do things.
Yeah, I thought that went really well as well. I thought they did a really good job of trying to figure out who was doing what, prioritization, everybody trying to figure out their roles. It was really well done.
And they asked good questions, too. You had asked if they had gotten a good report from us, from Tanya, which she did a great job. The Eau Claire students then clarified with some questions as well. So between giving and getting report, I think it was pretty complete.
I like that. I like the fact that they asked the questions they didn't feel. I think that was great. I thought you guys did a good job overall with communicating in that type of setting. I really did. Especially, I thought it was kind of chaotic at times. So I think overall, given what was going on, I thought it was good.
Yeah, you guys are doing definitely everything that you were supposed to be doing from a nursing standpoint over there, and you got the information that we needed. So when we just needed a clarification, you guys had the answer for it right there. So yeah, hindsight's 20/20, but you guys overall did a pretty good job over there.
Thanks. My one comment will be, and when all this stuff is happening, is I want to make sure that we try not to lose focus of our patient in general. So I think that was one of the things I noticed as we're trying to figure out what the heck are we doing, what do we need, what do we got to get, where's the equipment. Sometimes we tend to lose focus of the fact that the patient is sitting there. And I saw that all around. And I think that's just something to just kind of take yourself back to and consider. So as we wrap up here, I'd like to hear from a couple students, like summarize what you're going to take away from today.
Sparring communication will go a long ways.
I like that one.
The collaboration efforts will, because most of the time for most of our programs, both of us, we're focusing a lot on what we need to do and the things that we need to learn so that we can go and then do this and collaborate with other people and be effective as a team together. So it was nice to just have it all come together. And it was the first time, so it's always going to be rusty, but I mean, overall, I learned a lot about respiratory therapy. I'm sure respiratory therapy learned a lot about nursing, so it's nice to see it and do it, because it's not just about passing exams and doing that once you get out into the field. It's about making sure that the patient's okay and who you're talking to make sure that happens.
Before I'm passing on a report, make sure I touch base with everybody involved in the team, whether it's respiratory or nurses or doctors, nursing assistants, everybody, just kind of get their take on it and then pass on the report.
That's great. I really like that. I think everybody did a fantastic job We really appreciate you guys working together in order to make this happen. I think we learned a lot technology-wise as well. This was the first time through it, but I really think it was a great opportunity to get a little collaboration between all the campuses that we have here and kind of start working together a little bit more. So congratulations, great job.
We're going to be using this wherever we work, probably. So we've already got it. All of us got a little taste of what it's like and the challenges and what to take forward with that. So thank you, everyone, for
Thank you.
being a piece of it.
Yay. Round of applause. Yay. All right, bye, guys. Have a good weekend.